I'm Dr. Scott Fuller. We're going to talk about breast cancer prevention on this show. As a side note, one thing I'd like to do if I was the U.S. Health and Wellness General, if you all appointed me and I took that office, first of all, I would gather together a lot of very talented people, and then we would move forward in dealing with a lot of chronic disease, including cancer, and I would like to remove the word cancer from the English language and our memory of cancer. Wouldn't that be fantastic? So what would happen is a doctor would come into a patient, and let's say they had a growing group of unhealthy cells. They would go in and report to the patient, okay, here's your situation. You have a group of unhealthy cells in your body, and here's our game plan on improving your garden and making sure that your healthy cells are going to deal with and take over from the unhealthy cells. Wouldn't that be terrific, right? So if we could do something like that, is remove that word cancer, because there's so many people, when we hear the word cancer, when we just hear it, it provokes angst and anxiety and stress and so forth. It's just a word that we want to remove. Wouldn't that be nice? Okay. What prompted this show, and I've wanted to do this show for years, is a few years ago, I listened to a TED Talk. You don't need to know what a TED Talk is, but maybe after you watch one of them, you'll know what it's all about. A TED Talk was done by Robyn O'Brien, and she has a fantastic website and information. She's called the Erin Brockovich of the food industry. When you Google her, make sure you get the TED Talk. It's called TEDx Austin, meaning Austin, Texas, in 2011. In 2011. Now, she's done a lot of other talks that are fantastic, but I want you to listen to that one. That one is particularly good. At the 7-minute mark, she gets into the cancer thing, and she says, the United States has the highest cancer rate of any country in the world. If you move here from Japan, your rate of cancer increases by a factor of 4. 1 out of 2 U.S. men, 1 out of 3 women in the United States are expected to have cancer. 1 out of 8 women have breast cancer. 1 out of 10 of women with breast cancer are genetically caused. 9 out of 10 are environmental. Follow? 1 out of 10 is genetic. 9 out of 10 are environmental, or if you will, in your control and preventable. That is the crux of this show. Understand that cancer is a preventable illness. And all of us, but we're talking about breast cancer, women with breast issues, is the majority of it is by far in your control, and you should be rest assured that that is comfortable information, and that should really be a wonderful message for all of you to absorb. So then I started poking around, and I wanted to find more information. Well, how did Robyn O'Brien get to this? So as I started poking and collecting things for this show, I came across medicinenet.com. It's part of the WebMD network. And in 2013, they had a nice article on here. Inherited breast cancer disorders account for a small minority of breast cancers overall. You're going to see this as a consistent theme as we get into the causes. Then I'm going to talk about prevention. Genes can be damaged by the environment. Okay? So even if we have a genetically linked problem, let's say breast cancer, it could have been that our habits or exposures caused a genetic malfunction. Only in about 10% of all breast cancer cases is there actually a genetic defect that can be tested. This means that 90%, 95%, if you take the upper number, of breast cancers are due to other causes. In most cases of breast cancer that occur in women, they do not have a family history of breast cancer. Not have a family history. Now, what is the first thing that a doctor asks you? If you're going in and getting an interview for whatever reason, they'll say, what did your parents have? What did your grandparents have? What did your siblings have? That should not be the first question and the most important question that doctors and health professionals should ask their people that are coming in. The first group of questions, you'll see why in a moment, should be, what are your eating habits? What is your lifestyle like? Are you a regular exerciser or not? Do you smoke or not? What's your stress level like? Are you getting enough rest? Are you taking care of your spine and nervous system? What do you drink? Those are the questions that should be. And then at the end of that, we should ask questions, tell me about your mom and dad, tell me about your grandparents and siblings and so forth. CDC.gov, our own CDC, Centers for Disease Control, in 2014 has some statistics. Now I'm going to open up the numbers for us for a moment. And unfortunately, and I know this is a grisly thing to talk about, but I just have to give some numbers to shed some light on what we're going to do pushing forward. So for all Americans now, in 2014, causes of death, number one is heart disease. 614,000 people died of heart disease in the United States in 2014. All cancer, men and women, all cancers now, 592,000, number two cause of death. The number three cause of death is medical care. Out of that, you have 440,000 people that die from medical mistakes, and then you have 106,000 people in a hospital environment that take the right drug for the right diagnosis in the right manner. 106,000 people a year die from that, so that's 546,000 being the third leading cause of death. The American Cancer Society in 2015 numbers now came up with women that died of cancer, all cancers, was 277,000. Now let's break that number down into what kind of cancers. Number one by far is lung cancer, 73,000. What causes lung cancer? Almost 90% is smoking. Okay. Here's what I did. I took all of gastrointestinal cancers, so esophageal, stomach, pancreatic, liver, small intestine, colon cancer, added them all up, we came up with 63,000. Breast cancer deaths in women in 2015 was 40,290. Now remember, on the higher end, 10% of those, or 4,000, were caused by genetic defects. On the lower end, 2,000 are caused by genetic defects. So only 2,000 to 4,000 women got a genetically defective cancer, if you will, and then died from it in 2015. So we have to spend the rest of our time talking about how can we prevent it, right? The MD Anderson Cancer Center, huge cancer center in Texas, right off their website this past week, only 5 to 10% of breast cancers are inherited. Diet, making the right food choices is a powerful cancer prevention tool, they said right on their website. Tobacco use is accountable for at least 30% of all cancer deaths and 90% of lung cancers, of course. And physical activity and active lifestyle helps prevent obesity, which is a major risk factor for cancer. So if you hear obesity, think nutrition and exercise and so on and so forth. Okay. Now some references. Let's follow a timeline here now. I'm going to back up a little bit to 1996. So when we're taping this right now, Election Day in 2016. 1996, so 20 years ago, here's an article of the Journal of the National Cancer Institute. Premenopausal breast cancer risk and intake of vegetables, fruits, and related nutrients. Interesting. Background. Given the international variations in breast cancer incidence rates and the changes in breast cancer incidence among migrant populations, it has been hypothesized that diet is a factor including risk of this disease. Many studies indicate that a diet high in vegetables and fruits may protect against breast cancer. Conclusion of this article 20 years ago, in this population, intake of vegetables appears to decrease premenopausal breast cancer risk. By the way, they also said, we found a strong protective effect associated with the usual intake of vegetables and less strong in fruit. Many times I've told you want to be eating at least 3 to 1 vegetables to fruit, much more vegetables than fruit. Dietary fiber may affect breast cancer risk by decreasing reabsorption in the gut of estrogen excreted. We found again the association of risk with fiber to be confined to fiber from fruits and vegetables. Same year, 1996, Journal Cancer Causes and Control. Harvard Report on Cancer Prevention. I have mentioned this study before. It is worthy of review. This is a multi-page article, 60-something pages. Harvard Centers for Cancer Prevention has been established on the premise that prevention offers the best hope for significantly reducing the suffering and death caused by cancer. Summary, way down on page 55 of this report. Headline, cancer is a preventable illness. One of the most important conclusions to be drawn from this report is that cancer is indeed a preventable illness. Nearly 2/3 of cancer can be linked to tobacco, diet, obesity, and lack of exercise. They even broke it down into percentages. There's probably 12 or 15 categories here. Category number 1, I did this now. I interpreted this a little bit. They said adult diet causes 30% of all cancers, including breast cancer. Then down the road here, they had salt, other food additives and contaminants cause 1% of cancers. I added them together. 31% of cancers are caused by dietary choices. It's the number 1 cause of all cancers, including breast cancer. A close number 2 is smoking. Smoking causes 30% of all cancers, as we already said earlier. And then sedentary lifestyle causes 5% of all cancers. Some quick math, you're already at 66% of all cancers, including breast cancers, caused by one of 3 things. Whether you eat good things or not, whether you smoke or not, or whether you exercise consistently or not. So we should spend 66% of our research, money, media time like this fantastic show that you're watching right now, newspapers, magazines, articles, interviews, everything else, at least 2/3 of it should be about those things. Are we doing that right now? No. By the way, on this chart, family history of cancer, 5%. It is mostly not a genetic disease. It is caused by lifestyle. That's why the United States has the number 1 rate of cancer in the world. 1 year later, 1997, again, the journal Cancer Causes and Control, Harvard Report on Cancer Prevention, Volume 2, another lengthy report. Dietary change. Nutrition plays an important role in the initiation, promotion, and progression of cancer. Okay, so nutrition is it. Here they are a year later saying the same thing. Low consumption of fruits and vegetables, high intake of saturated fat, and physical inactivity are related to increased risk of cancers of the colon, prostate, lung, and breast, as well as total cancer mortality. And summary, they again said smoking, an estimated 30% of all U.S. cancer deaths can be attributed to smoking. 30% of all U.S. cancer deaths are attributed to nutrition and diet, and then physical activity is involved, as we talked about. We're going to fast forward a little bit to the British Medical Journal in the year 2000. British Medical Journal, high insulin levels. This is new to me. I dug this one up. High insulin levels linked to deaths from breast cancer. High insulin levels. What does that mean? The body's producing more insulin. Why? We're having blood sugar dysregulation problems. How much of a problem is that in the United States right now? It's huge. It could be the number 1 thing, blood sugar dysregulation. Why? We eat a bunch of bad stuff. We sit a lot. We drink sugary things, messing up our sugar metabolism. Increasing, and then of course the body in its innate response to try to handle everything pumps out a bunch more insulin. Now you have higher insulin, it's trying to store sugar, it's trying to jam it into cells, all kinds of dysfunction is happening. It is not entirely surprising to find that insulin may be implicated in breast cancer. Insulin is usually associated with diabetes and controlling blood sugar, but it's also a cellular growth factor. Remember, we talked about cancer being unhealthy cells growing out of control. Although further research is needed to confirm and clarify the roles of insulin in breast cancer, the findings suggest that patients with breast cancer and high insulin levels may be able to reduce risk of progression by modifying their diet and exercise. Even more recent, March of 2010, 6 years ago, Annals of the New York Academy of Sciences. Title of it, The Dogmas of Nutrition and Cancer, Time for a Second Look. Nutrition and cancer may be one of the widely discussed areas of cancer prevention in the world, as it should be. There's no shortage of articles on this subject. PubMed, which is our database, the governmental database of research, all research, they counted 8,500 articles dealing with nutrition and cancer. I did my own search in the past week. I just put in PubMed now. I put in nutrition and cancer, and I got 33,000 hits. 33,000 articles. And that doesn't mean that each of those 33,000 articles is dealing with nutrition and cancer. It just means that those search terms came up. But there are thousands of articles dealing with this. And of course, Oh, I wanted to tell you the conclusion of this one. Conclusion: it is probably wise for us to accept the experts' view that 33% of cancers can be prevented or modified by changing our diet and exercise patterns. And I thought they mentioned smoking here. Yep. And a third of all cancers in high-income countries may be attributed to smoking. So once again, back in 2010, 14 years after the other stuff that I was just telling you about, they're saying the same stuff. 63% at least of cancers, 2/3 of cancers, are due to nutrition, smoking, and exercise. One of the best, if not the best, resource that I can find right now for you, whether you want to prevent cancer or, God forbid, you've been diagnosed with cancer, or somebody in your family, or a friend, or a coworker, or whoever it is. One of the best resources I know of right now is thetruthaboutcancer.com. Thetruthaboutcancer.com. And as I get into this, I wanted to show you a couple of things. These wonderful people put together a collection of material. In 2015, they did a very long online symposium, at least 10 hours. I bought all the CDs. I bought the entire transcript of all of that, listened to it again, and then Ty Bollinger came up with a book now that just came out. This is hot off the press. I literally have just been flipping through it right now, called The Truth About Cancer, hence thetruthaboutcancer.com. And there's a prevention chapter in here that's just fantastic. Basically, a global quest on the truth about cancer. They went around the world and they started finding out what people are doing, why lower rates are in areas around the world, and so forth. They also interviewed people in the United States and around the world that are doing alternative cancer therapies and getting great results. And they were wondering, what is the consistency? So this is such a great resource. Go there. Here's a couple of things that they're mentioning. Overall death rate from cancer has only decreased 5% in 60 years. Chemotherapy started in the 1950s. It's been a dismal failure to save lives or cure cancer. We have made some progress on lymphoma, childhood leukemia, and testicular cancer, but we've made no progress on the big killers: colon, lung, breast, prostate, ovarian, brain, and liver cancers. As many of you have heard, survival length that we have all heard about, those improvements are largely due to finding cancers earlier, and the rates of cancer in the world exploded after the Industrial Revolution. So there's just some notes in there of things that they wanted you to know about. What they're getting at, the Truth About Cancer, Ty Bollinger, and all of the people that are involved with his organization. Causes of cancer, once again. Number 1, unclean diet. Number 2, whether you smoke or not. Number 3, sedentary lifestyle. So are you exercising consistently or not? Number 4, excessive alcohol. And as we get into that here, regarding alcohol and its relationship to cancer, there is a relationship. So the goal should be none. None is the best choice. If you're going to have some alcohol, the idea is as little as possible is the second best choice. And you should have many alcohol-free days. It's not the old thing if you hear 1 to 2 drinks per day for adults is okay. Most of the research is saying that's too much. You should have several alcohol-free days, and if you are going to have some, 1 to 2 drinks, and that's it. So there it is. Excessive alcohol is linked to increased risk of cancer, including breast cancer. Chronic stress. We don't have enough to dive into this, but I think this is one of the unsung things that we need to focus on as a country, as a world, on reducing cancer. I don't know of any numbers. I haven't come across any right now. But chronic stress, not acute stress. We can handle acute stress. The human body is designed to handle acute stress, and it's there for a reason. We're talking chronic stress, which suppresses the immune system. Things like unforgiveness, bitterness, negative, critical, and judgmental attitudes. Don't forgive or hate yourself. Work, finances, relationship pressures, divorce, death of loved ones or pet, job loss, house loss, and so forth. Chronic stressors increase insulin, increase cortisol, increased rates of cancer. Pollution, we're going to touch on that before we're done. Chemicals that we're exposed to in the environment. No, we're not going to be able to remove our exposure to all chemicals totally, but we can mediate them a little bit. Certainly our personal exposures to chemicals, we're going to talk about in a couple of minutes, we can reduce that. As we get into prevention, why don't we as a society talk more about cancer prevention? Let me tell you why. And the first quick answer is money. Of course it's money, right? People don't make money when they do a television show like this to tell people cancer is preventable, you need to do these things. Imagine too that, could we tolerate, as an example, let's say I form a group, I'm the US Health and Wellness General, and we've got some great people involved. Tomorrow we were able to reduce cancer rates by 50%. Pharmaceutical consumption goes down 50%, and big food, all the big processing food companies decrease production by 50%. Now, can we tolerate all of those great paying jobs with great salaries and 401ks and great retirement plans and Cadillac medical insurance and 4 weeks or 6 weeks off a year or whatever it is? Can we tolerate all those job losses, and then basically Wall Street would have a major recession and so on and so forth? Would that be tolerated? No. I think I would have a freak accident if that happened. But anyways, it's just not going to happen. So we have to save each other one by one, community by community, by doing these things. That's why we don't talk about it. Plus, we also talk about hard things. Is it easy to change your diet and go eat things that don't taste good and stop eating things that taste good? That was a joke. It's hard to do that. In my chiropractic office, I find the most difficult thing for me to help people do is to change their diet. It's hard for me. It's hard for all of us. Good foods that taste great, that are really bad for us, are totally addicting. Large food companies are psyched when we talk about that too, because they know we cannot say no. So these are the situations of why it's so difficult. It's also not romantic to say, hey, we have 5 people that never got cancer. Will be. But if somebody says, I've got the cure for X cancer, boom, media everywhere. Everybody's excited about that. Follow? Okay. Rest of the show, let's talk about preventing cancer for all of us. So, I have some resources. We talked about the truth about cancer. Also, mammography. Anything I say on this show is not medical advice. Anything that you decide to do is up to you, and you only. Not from what I said here. And you need to discuss these things with other people you care about and your doctors. I'm not giving any medical advice. Regarding mammography, there's excellent information out there, and you need to do your homework. And you also need to look at thermography, breast thermography, as a potential alternative. So look at that. The Truth About Cancer has resources on that. drmcdougall.com, fantastic information on cancer prevention and also on mammography and thermography. Mercola.com. Talked about him many times. He probably has the most popular website on health and wellness and disease prevention on the World Wide Web. drhyman.com. We're going to talk about him in a moment and some of his strategies. Great resource. drfurman.com. Another great resource. Many of you might be familiar with these doctors and their names. drgonzalez.com. He's doing alternative cancer therapies and getting great results, even though sometimes he gets medical boards and stuff like that up in arms, even though he's doing great things. Suzanne Summers. Suzanne Summers is the actress. She has some fantastic information out there as well. The book that I read of hers is called Knockout. Fantastic book. The reason it's fantastic is because she interviewed 12, mostly doctors, some nutritionists, 12 people in this book. Each chapter has an interview of these people doing cancer prevention and alternative cancer therapies and getting fantastic results. Great book called Knockout. So check that out. Gearson.org, Gearson.org. That's been around for decades. Check that out as alternative cancer therapies and prevention. Dr. Russell Blaylock, he has a book called Natural Strategies for Cancer Patients. I have not read the book myself. I have heard it's a fantastic read. I read Dr. Blaylock's book called Excitotoxins of the Taste That Kills, which was a great book all about the fake sweeteners that are really bad for you, which is why it's the taste that kills, and all the artificial food taste enhancers that make foods taste good and so on and so forth. drkelly.info. Dr. Kelly has a great site. And then I talked earlier about Robyn O'Brien. She has a great website. Regarding chemical exposure, reducing your personal chemical load and of your family, this is the best website that I've ever seen by the Environmental Working Group, ewg.org. You might have heard about Skin Deep. It's their rating system of personal care products, everything from cosmetics to shampoos to lotions and sunscreens and so on and so forth. They also talk about pesticides and produce. They have an article on the dirty dozen endocrine disruptors, and they also review 2,000 household cleaning products. Get rid of the poisons in your home. Make better choices on carpet and tile and paint and rug and all that kind of stuff. And EWG can help you for there. Another website new to me is called betternutrition.com. A naturopathic doctor, Dr. Kane. She talks about preventing cancer with eating organic and farm to table whenever possible. Avoid fried foods. Breast cancer is estrogen driven, so be careful of using hormones, is what she suggests. That means food that you eat that are raised with hormones, be careful of that. You want non-hormone meat and organically raised and grass-fed and no antibiotics and so on and so forth. We know antibiotic use increases risks of breast cancer as well. Check out her website. I wrote an article years ago that I talked about on this show, is the cure for cancer is prevention. So we need to focus our attention on that. My strategies, as I said, was eat clean, lots of vegetables. Dr. Oz said the first defense of cancer begins with every forkful of food you put in your mouth. I talk about exercise. Daily exercise is the goal. Don't smoke, reduce stress, regular rest. And I also mentioned, being a chiropractor, chiropractic care. There is no articles about chiropractic preventing cancer. There's none. But if you want to give your body the best chance to reduce your chances of all disease, you want to make your body as healthy as possible. There are research articles that show that chiropractic care may reduce blood pressure. Chiropractic adjustments stimulate blood flow in the brain. You activate brain, you're affecting all systems. There are chiropractic articles, and in my experience, that for some kids with chronic ear infections, respond to chiropractic care. There's the immune system link. So a better spine, cared for spine, means a healthier body. It's going to help you with everything, so I recommend wellness chiropractic care. Dr. John McDougall on his website, drmcdougall.com. Fantastic website with tons of information, videos, audios, newsletters on all kinds of disease prevention, including breast cancer prevention. He will get very specific in there, and he will also give you information about mammograms. Low-fat, plant food diet slows breast cancer is one article that he wrote. Raw food vegetarian diet protects us from cancer. I'm not saying that you need to be a vegetarian to do this, but he will show you that that's one angle. Feed your children right. You might actually remember this. The French fry article that came out in 2005, one additional serving of French fries per week in kids meant a 27% increase of developing breast cancer later. Habits now affect us later. That's what he's getting at. And again, Dr. McDougall says the breast cancer treatment is diet and exercise. drwild.com, he says, reducing breast cancer risks by maintaining a healthy weight, which is diet and exercise, regular exercise, reduce exposure to poisons in your environment called xenoestrogens, avoid alcohol, avoid long-term hormone replacement therapy, says Dr. Weil, nutrition and supplements, eat lots of vegetables and fruit. You're going to see these to be common things as we move along. Here's a book that you might want to be interested in getting. Breast Cancer, Reduce Your Risk with Foods You Love, a 2011 book by, Dr. Prendergast. Dr. Joel Furman, his list, same thing, 10 things. Don't drink alcohol, don't smoke, don't take estrogen. Reduce consumption of animal protein, eat lots of vegetables, use supplements wisely, and exercise a lot. Even on the Harvard Medical School, Harvard Health Publications in 2009, they say, avoid tobacco, eat properly, exercise regularly, stay lean, limit yourself to very small amounts of alcohol, avoid exposure to chemicals whenever possible, get enough vitamin D. Xenoestrogens, I have a article on here. I want to get you to how to get there. Oh, breastcancer.org, an article by Amy LaRue. It talks about xenoestrogens and avoiding estrogen-stimulating chemicals in the environment. Dr. Mark Hyman has a great article as well, so look at his website for altering your genetic expression, which is called epigenetics, by your health habits. And then lastly, vitamin D, just vitamin D has shown to significantly reduce your rates of breast cancer by just upping your vitamin D intake a few thousand international units per day. I'm Dr. Scott Fuller. Please join me again.